You've noticed that walking makes your back and leg pain worse, but sitting down or leaning forward gives you relief. If that sounds familiar, you may be dealing with spinal stenosis. Welcome back to this series on low back pain. Drop a comment below if this is your experience and how long you've been dealing with it. Alright, let's get right into this really specific pattern of symptoms because it tells us a lot. So here's our game plan. We're going to start with that telltale symptom pattern. From there, we'll unpack what spinal stenosis actually is, why your MRI scan is not your destiny, what causes this narrowing in the first place, and, the most important part, what the evidence says you can do about it, and what your outlook really looks like. Okay, so let's start with what you're actually feeling, because when it comes to spinal stenosis, your story is probably the single most important piece of the puzzle. This unique pattern, feeling worse when you're walking and standing, but better when you bend forward, it's so classic it's actually got its own nicknames. The big one is called neurogenic claudication. Now, this isn't just any old pain, it's a very specific set of symptoms. Pain, maybe some tingling, or even just a heavy, weak feeling in your legs that reliably kicks in when you walk or stand for a bit. What's happening underneath is really a two-part problem. There's some mechanical crowding of the nerves, and that upright posture reduces blood flow to those same nerves. And this brings us to the famous shopping cart sign. It's the perfect example of the solution, right? When you lean forward on that cart, you're bending or flexing your lower back. That simple movement physically opens up a little more space in your spinal canal, taking the pressure off those crowded nerves. It's instant relief. It's the exact same reason why riding a stationary bike, or even just walking up a hill, often feels a whole lot better than walking on a flat surface. Now, this classic pattern leads to a really crucial question that has to be asked. Is this leg pain coming from the nerves in the back, that's neurogenic, or is it a blood circulation issue in the arteries of the legs, which we call vascular claudication? You have to get this right, because the treatments for these two things are completely different. And here's how you can tell them apart. With neurogenic claudication from stenosis, the trigger is your posture, being upright, walking, or just standing around. Relief comes from changing that posture by sitting down or bending over. But with vascular claudication, it's all about exertion. The pain shows up after a pretty consistent distance, and all you have to do is stop and stand still for it to ease up. The bike test is a fantastic tiebreaker. Because you're bent forward on a bike, it's usually fine with stenosis, but it'll definitely trigger the pain if it's a vascular problem. Okay, so we've got the symptom pattern down. Now let's zoom in and look at what is physically happening inside your spine. At the end of the day, it's really just a matter of space. Lumbar spinal stenosis, in simple terms, is just a narrowing of the open spaces in your lower back. This can happen in the main central canal, where that big bundle of nerves travels, or it can happen in the little side tunnels, the neural foramina, where the individual nerves peel off to exit. And it's really important to remember, just like the age-related changes we discussed in our spondylosis explainer, this isn't an on or off switch, it's a spectrum, ranging from kind of mild to more severe. Now, this is maybe the most important point I'm going to make. Just because a scan shows there's some narrowing, it absolutely does not mean you're destined to have symptoms. The research is so clear on this. About 1 in 5 people over the age of 60 has what you'd call spinal stenosis on an MRI. But guess what? The huge majority of them, around 80%, are just walking around living their lives with zero pain. And that leads us straight to the topic of scans. Look, an MRI can be really helpful to confirm what's going on, but it's so vital to understand that those pictures are just one piece of a much larger puzzle. What you feel and what you can do, your actual experience, that's what really counts. So does a worse-looking scan mean you'll have worse pain? Well, there's a connection, but it's meh. It's not nearly as strong as you'd think. If you rate the connection on a scale from 0 to 1, with 1 being a perfect match, the link here is only about a 0.3 to a 0.6. What that tells us is, yeah, there's some relationship, but your scan does not define your life. Plenty of people have bad scans and feel pretty good. This quote from a major study really hits the nail on the head. They looked at a group of people, all of whom had severe stenosis on their MRI scans, and what they found was that there was no real link between how severe that scan looked and how much disability the person actually reported in their day-to-day life. It just wasn't there. So if the scan isn't the whole story, what is actually causing that narrowing that we see on the image? Well, for most people, it's the result of a very common age-related process that we call the degenerative cascade. In this cascade is a few things happening over time. Your discs can lose a bit of height and start to bulge. The little joints in the back of your spine, the facet joints, can get a bit bigger. That's what hypertrophy means. Your body might form some bone spurs, and a big ligament in the back of the canal can get thicker. You see, none of these are a huge deal on their own, but together they can start to slowly reduce the amount of space available for those nerves. Alright, that's the what and the why. Let's get to the most important question. What can you actually do about it? What does the best evidence we have say about how to manage this? For almost everyone, the journey starts with an active, conservative approach. This means things like supervised exercise to help you build strength, and just as importantly, confidence in your body. It means progressive loading, which is just a fancy way of saying gradually asking your body to do a little more over time. And yeah, it often focuses on those movements that create space, like cycling. But a huge piece of this is also education. Just understanding what's going on can make a world of difference. Now, here's something that's really empowering to know. When we look at the long term, the story is pretty interesting. It's similar to what we see with sciatica. While surgery can definitely offer faster relief for some people, when you look out over a few years, the outcomes for people who stick with a good conservative plan often catch right up to those who had surgery. Now, that doesn't mean surgery is bad or should never be considered. Not at all. It can be absolutely the right choice for the right person, but it should always be a thoughtful conversation, not something you feel pushed into. Large-scale trials, including the SPORT trial, have consistently shown that for most patients, conservative and surgical outcomes converge significantly by 2 years, making surgery principally a decision about the speed of recovery rather than the final destination. So when does that conversation make sense? Well, the guidelines are pretty clear. First, you've given a really solid, dedicated effort to conservative care, and it just hasn't gotten you where you need to be. Second, and this is a big one, you're experiencing a progressive neurological deficit. That means a leg is getting noticeably and consistently weaker over time. And third, the symptoms are limiting your function so severely that your quality of life has really taken a hit. So let's wrap this up by talking about the big picture. What's your prognosis? What can you really expect moving forward? And I want you to hear this. The outlook is, for most people, very good. Getting a diagnosis of spinal stenosis is not a sentence to a life of sitting on the couch or an inevitable decline. That is a really common fear, but it is just not what the science or clinical experience shows. The vast majority of people learn to manage their symptoms really well with these active strategies, and they go on to live full, very active lives. So I'll leave you with this to think about. If we know for a fact that your MRI scan is not the whole story, then what part of your story are you going to focus on today? Is it going to be your movement, your strength, or maybe just your understanding of what's happening? Because that is where the real power to change your story lies.